Good morning. Okay, everyone's still sleeping. Good morning.
Good morning.
Thank you very much. I have a lot to say that I want to cover, and some of it is quite complicated. So I've tried to make this talk not too painful by giving demonstrations and illustrations. And I also put it on the web. The web address is on the screen, where I have a copy of the presentation and additional materials, and my email for people who want to talk later on and to continue. I want to start off by thanking the people who invited me here. I'm very happy to be here. I've been very impressed with the conference, and I do think that you have a great future doing very important work. What I'm going to talk about today is the paradoxical nature of expertise, the good, the bad, and the ugly. So we can start off perhaps with a question: who wants to be an expert? Pick up your hand if you want to be an expert. Yeah, of course, everybody wants to be an expert. Why not? Who doesn't want to be an expert? You're respected, you're invited, you get paid for it, you feel you can do a lot of work and contribute, and so on and so forth. And indeed, we are in the business of being experts. Our area requires expertise, and not only are we experts, but we're working in an expert domain. There are experts that work in non-expert domains. You may be an expert on teaching children how to cross the road, and crossing the road is not a real expertise. But the medical domain is a very highly skilled expert domain, so you are working as experts in an expert domain, and your job, your expertise, is in making experts, in training students or nurses or any staff and trying to make them experts. So you can see that expert and expertise really defines where we're coming from and where we want to go to. However, be careful what you wish for, because there is good in being an expert. There's a lot of good, and I'm not going to deny it. And I'm going to tell you that being an expert enables people to perform quickly and efficiently. However, there's also bad things about being an expert and some ugly things about being an expert. So you need to know what you're getting into when you want to be experts or you want to train people to be experts. And when I say you need to know what you're getting into, I don't mean to discourage you trying to be an expert and for you to get out and to go to the swimming pool before the airport. On the contrary, but I think that if you really understand the notion of expertise, you can do a better job. You can be a better expert yourself, as well as train people to become expert. If you understand expertise and performance is very important. You can increase the good, you can decrease the bad, and hopefully really push down and maybe eliminate the ugly side of expertise, and I will talk about all of that. This is what the talk today that I'm going to mention. Again, I have not a lot of time, about an hour, so I'm going to go quite quickly and only scratch the surface. It's a complicated topic, and my approach is a cognitive approach, a cognitive perspective, which I'll explain to you. I'm a cognitive neuroscientist, and I'm interested in human performance and people's ability to perform skills, judgment, and decision-making, and especially in expert domains. I have no specific interest in the medical or in healthcare, but in expert performance. I work a lot for many years with the US Air Force, police, forensic, and medical, and looking at improving performance, what is the most effective way to acquire skills, how to make best possible decision, avoid and minimize error, and a whole bunch of other stuff. There are many ways to achieve that, and training is one aspect. And training includes a lot of different activities, and some of them involve technology-enhanced learning. And within that, we have simulations. And we need to think about simulations. Some of the things that will make simulation effective are the same for other technologies in training, and for training that doesn't use technology. There's nothing special about simulation. Some of the pedagogy and the training is the same. However, some things are specific and unique to simulations, and some things are effective from other areas of training, but get a new light and a new perspective when we talk about simulations. I'm going to be talking about expertise. There's a book out called The Paradoxical Brain, and there's a paper, The Paradox of Human Expertise, Why Experts Can Get It Wrong. And the summary of the paper is basically that expertise is correctly but one-sidedly associated with special abilities and enhanced performance. The other side of expertise, however, is hidden. Along with expertise, performance may also be degraded, accumulating in the lack of flexibility and error. Expertise is demystified by explaining the brain functions and cognitive architecture involved in being an expert. These information processing mechanisms, the very making of expertise, entail computational trade-offs that sometimes result in paradoxical functional degradation. For example, being an expert entails using schema, selective attention, a chunking of information, automaticity, more reliance on top-down information, all of which allows experts to perform quickly and efficiently. However, this very mechanism restricts flexibility and control, may cause to miss and ignore important information, introduce tunnel vision and bias, and can cause other effects that degrade performance. Such phenomena are apparent in a wide range of expert domains, from medical surgeons and forensic examiners to military fighter pilots and financial advisors. And you can see there's a lot of good stuff. Special abilities, enhanced performance, perform quickly and efficiently, all good stuff. But there's also error, and we heard yesterday in the keynote speech a lot of talk about error. In the first 2 days, we heard from the keynotes how important of improvising and being flexible when you play jazz or NASA astronauts, but we talk about restrict flexibility, lack of control, miss and ignore information, tunnel vision, bias, and a lot of stuff. And this is not the ugly stuff, it's only the bad stuff. It's not ugly because this is the inherent making of expertise. The understanding of what makes an expert entails these things that are not so good. And there is ways to eat the cake and have it, but you really have to understand the underlying cognitive mechanisms, which I'm going to talk about today. We have to talk about human cognition and start thinking about the brain, how the brain processes information. And it's not the information that comes into the brain as much as what does the brain do with it. As I like to say, the mind is not a camera. It's from a paper, Perception is Far from Perfection, from the journal Brain and Behavioral Sciences. Stop treating the brain and your students and whoever you're training as a passive machine that takes it on board. It's not like that. You really need to understand what the brain does, how we process information. And we focus on the learner's head, not on the simulations. The simulations are an instrument. They're not an objective. And don't let the simulation drive you. It's just a technique, a way to try to train better. And training is training the brain, the cognitive of the people who are doing it. This sounds all very nice, but let me show you some examples of what I'm talking about. So I'm going to put something on the screen, and I want you to count how many times the letter F is there. Give you time. No time pressure, even though you do work in time pressure. Do you need more time? No. How many people see 3? Pick your hand up. Almost everyone sees 3. There are 6. For the people who see 4 and 5 also, there are 6. Okay, let me show you the 6. So first of all, I'll show you 3. The 3 that everybody sees, finish, files, and fic. But there's also 3 ofs. Of. Are you blind? Can't No, you are experts. Experts in reading. And as you become experts, you learn what to pay attention to and what not to pay attention to. So you read a lot and you know of, they don't say anything, so your brain doesn't register it. It gets to your brain, it's not that you're blind, but the brain ignores it, because being an expert means ignoring information that the brain decides based on your expertise is not important. And I can motivate you. We bring students, we offer them £1, about $1.6 for every F they count. You can get a beer and a pizza and happy hour. They're very motivated, but they don't see the 6 Fs. And this is just an example to illustrate miss and ignore information. So what I read to you initially, I want to decipher it. So here's an example where the expertise causes you to miss and ignore information, because as you're an expert, you increase your selectivity. Okay, so we've seen this example, but it's not only in what you perceive. Here I showed you what you perceive, but it gets much more interesting. But flexibility in the knowledge you use. We heard how important it is to be flexible, to improvise. Well, being an expert means that you're not. You rehearse things and you practice, and you decrease your flexibility. Let me give you an example of knowledge that you know very well, but you're not very flexible. Can anybody tell me the months of the year by alphabetical order? I bet that you can't. I'm going to take my wallet out. $20. $20 if anyone wants to tell me the months of the year by alphabetical order. Anybody wants to try? $20, the easiest $20. Okay, I'm going up to 50. I'm not going beyond 50. Okay, a real $50 bill if anybody wants to try to say the months of the year by alphabetical order. Anybody wants to give a go? You guys must make a lot of money if you don't want it. Okay, fine. No, that's fine with me. But it's good that you didn't try, because people cannot do that. Because try to do it if you want to, quietly. And it's very hard, because it goes April, August, December, February, January, July, June, March, May, November, October, and September. Now, it's not that I'm flexible, but I don't deserve that, because I was cheating, because I practiced this quite a lot. I'm not flexible, because the way I was trained, the way you were trained, and you rehearsed it again and again by chronological order, formed a certain mental representation. And the better you are, the more you practice it in the military, with police, in the medical domain, then the less flexible you are, because you chunk it and you do a lot of cognitive processes. So this is just an example of restriction in flexibility, because you know something so well, you know it in a certain way, and it's a problem. So not only what you perceive, you couldn't perceive all the Fs. Not only the use of knowledge, alphabetically saying the months of the year, but making correct judgments. So let me show you an example of making incorrect judgments. So I'll put a picture of what is really football, not what you call football on the first day. You call it soccer here. And there are 2 pictures here, and you can give it to expert judges to decide if there's a foul, if there's a penalty committed, and you show them a bunch of pictures. For example, picture A and B is the blue player committing a foul on the red player. In fact, the pictures are identical. The only difference is the direction of motion. In one picture, it's from left to right, and the other picture is from right to left. And we know, and I don't have time to get into it, every demo I give you, I can talk for an hour or 2 on. I'm just giving you some illustrations that there's a directional bias, at least in countries that read from left to right. They have a preference from things to left to right, and when we give it to professional judges, you see they're more likely to judge and say there is a foul because of the direction of motion, which is irrelevant. It's a bias of what the brain likes. And in fact, I'm sure you haven't heard about this bias, but Hollywood producers heard about it and know about it. Next time you watch a movie, you will see all the good guys come from this side and the bad people from this side. So it's very important come to the podium from this side. You're going to like me more than I come from this side. And you see it next time you see a Hollywood movie, you'll notice that they do it consistently where the good and bad people in the movie come from. This is an example of a bias, an unintentional bias because of how the cognitive system works and how it can result in error in judgments. This is just a few examples to illustrate some of the things I'm trying to talk about. To say to you that the human element stands at the center of healthcare, and you know that because you have to perceive information, you have to interpret, to make judgment, decision-making, you have to carry procedures, and we must deal with improving healthcare through understanding of human cognition. We're not doing so well because we don't take it as much as we can, as much as we should, understanding the human cognition within the medical environment. Many times people think it's a public policy issue. It's not a public policy issue. Many times people think we'll have technology, e-learning, simulation, that's going to solve it all. And just throwing without taking into account the cognitive issues of what we need to do is not the right approach. Let me give you a few examples. We saw examples yesterday in the keynote on medical error. What's interesting is what they do about it. So here's an example that Medicare pulling the plug on hospital errors. So they want to minimize hospital errors. What they do, they're going to not fund errors. They say, why should we fund it when they make a mistake? You know, if somebody goes in, they amputate the wrong leg, then they found out, then they amputate the right leg, and Medicare used to pay for both operations. So Medicare says, I'm not going to do that anymore. I'm not saying they should pay for them, but if they think, like they try to claim, that by doing that they're going to reduce a mistake and people are going to stop amputating the wrong leg, they're wrong. So that doesn't work. They've tried that, and you know what? It hasn't really worked. So what do they do when that doesn't work? The public policy, because in the wrong state of mind, they're starting to fine. So this is another example. Third instance this year, a doctor performed brain surgery on the wrong side. We are extremely concerned about this continuing pattern. I hope that David Gifford is not in the audience, but they're very concerned, and they should be concerned. But paying a fine of $50,000 is not addressing the cognitive issues why this happened to begin with. And I can go on about this, but the point is we have to deal with things by understanding the human cognition within the medical environment, and the medical environment is a very challenging environment. There is time pressure many times, which means the quality and the quantity of information when you make decisions is not ideal. There is risk-taking. We have a whole research, which I will not talk about, what happens to risk management, risk perception under time pressure. So we have the same operations done with and without time pressure, and under time pressure, do people take more risk or do they take less risk? And it's on my webpage, and I'm happy to talk about it. You have to be flexible and adaptable under time pressure. We've talked about that. And the cognitive systems involved. They have two different brain areas, two different cognitive systems making decisions. One of them is more analytic and rational, and one is more intuitive and experiential. And many times we train one decision support system of the brain, but actually during clinical work, that system doesn't determine. It's a different system in the brain that actually makes the decision. So we need to think about that. There's a lot of piecemeal of information, what we call distributed cognition. It's not one person. There's a whole team of people that makes decision, lack of continuity with the handover, and technology. There's lots of technology. It can be very helpful, but a lot of the technology is not brain-friendly, and it's not helpful. For example, the monitors in ICU are set at a very low threshold because they don't want to get sued, that they will not go off. They go off all the time. 95% are false alarm, so the medical staff basically ignores it. It makes the patient and the family very stressed, but it's not a technology that's really done in a friendly way. If you add to all these problems human cognition that I've talked about, if you add that expertise makes some of the problems more difficult, then, ladies and gentlemen, we have a big challenge here. And we need to start thinking about how simulations can help us with that. To make things more complicated, there are three perspectives that we need to think about. One is acquire. We need to acquire knowledge, skills, and information. Minimal investment and maximum return. And I'm not talking about you, I'm talking about the learner in terms of the cognitive calories, the effort they need to spend on learning. You want them to get as much as possible to make it cognitively friendly so they can acquire a lot of information. And they need to remember it, able to remember it, because many times people learn really well. You test them after they've done the learning or the training, simulation or not, and they do very well. But if you test them 6 months later or a year later, you see a huge degradation. Many times they don't remember anything a day later. So we need to make sure that it doesn't go in one ear and out the other ear, they don't remember. And sometimes it doesn't even go in the first year, they don't acquire the information. And of course, we need to make sure that they apply it in the medical domain. We're not talking about an academic domain that they need to just know it theoretically. They need to apply it. We want it to modify behavior. So they go back to the bed in the hospital, to the patient in the clinic or whatever, and it transfers from the simulation to actually affecting what they're going to do. And it generalizes, because in the simulation you cannot capture every scenario. So they need to generalize from what they've done in the scenario, in the simulation, to the real life. And many times these two are a bit neglected. They're not used as much. What's interesting from a cognitive perspective, they're very different. These three things, acquire, memory, and application, are three different locations in the brain, three different cognitive systems, but yet they're intertwined with one another and interdependent in a very complicated way. For example, there's a trade-off. Sometimes you can have people acquire information very quickly, but they're going to forget it, they're not going to apply it, or they're going to apply it and not be able to be flexible. If you give more training in different ways, they're going to remember it better and be able to apply it better. But many times there are simulation centers, we need to have 1,000 students through the simulation in the next 3 weeks. So the idea is how many people go through the simulation, and sometimes you want to spend more time and do more simulations because that will increase the retention and the ability to apply. Mental representations. If they acquire the correct mental representation, they're going to remember it, and they're going to use it. If they acquire a different mental representation, they're not going to remember it, they're not going to use it. And during the stage of acquire, it's the same effort. You just need to know what mental representation, what kind of learning, what you're trying to achieve. And again, I'll show you a few examples so you'll see what I'm talking about. The point is, you need to understand the cognitive system to achieve it. And you can cheat on the trade-offs many times if you understand how the brain processes information. Before I show you the examples, what is this all about? We're here to improve patient care, patient safety, and we need to reduce the amount of errors and mistakes. We want to make sure risk is managed properly in the domain, correct decisions are made, depending on judgment and interpretation and perception of information. So we really need to go up this pyramid relying on cognitive science and human factors, because we know a lot about these areas. If you want to go up the pyramid, if you take shortcuts, I think there may be a problem. And remember, we want to talk about that they acquire, remember, and use it. I didn't talk about the ugly part, which is the metacognition. I've been talking about the good and the bad, and I will get to the ugly in a few minutes. So basically you develop and you deliver simulations, debriefing, that's great. But I ask you, do they follow the design the way you intended, the learning? Because they can do exactly what you wanted, but the lesson they take is different. When I teach in the university, the students learn not the material that I teach, they learn how to pass the exam, which is very, very different. So do they get from it what you really want to? And even if they do, are they going to remember it? And even if they do, are they going to go back, and are they going to use it back in the workplaces? And you need to be able to say, as experts, or people who want to be experts in simulation and healthcare, you need to say yes, yes, to all these questions and how you're going to achieve it. And again, we need to go into the cognitive system, and I'm going to try to give you a few examples of what you need to know and how we can make it better so you get a good feeling. I'm covering a lot of material, and I apologize. But It's the last day, the last one, so you can go quietly home. Okay, first of all, without insulting anyone, we're a machine, we have a brain, it processes information. And not only we're a machine, we are a limited machine with limited resources. I apologize again, I'm not only calling you a machine, but a small machine, what's in your head, but that's what we are. We have limited capacity, limited cognitive resources to process information, and this leads us to be intelligent and expertise. If we had a real big brain, we'd never be intelligent. The reason humans are intelligent is because we have a small brain. We can't process all the information, so we need to start deciding what's important, what's not important, start planning for the future, and this evolutionary bottleneck has started to push us to be sophisticated. How can we achieve what we want to achieve, regardless of the smaller brains that we have that can't compute all what we need to compute? And this is the key aspect to simulation, because you need to know what shortcuts a brain takes, what the brain takes on board, how it's going to process information. For example, the concept of limited resources and attention, cognitive load, you all heard about it, but it's very complicated. You really need to understand it really well to know what you can use with it. And if you just ignore it and you put too much load on the students, you're going to find them going to be like an ass up in the air. That's how you're going to end up. Cannot burden take the load, too much load. There's information selectivity. You can't avoid it. We have limited resources. You don't want to avoid it. It's a good mechanism. It enables you to decide what's important or not, like the letter F. You don't want to see that in the of. It's not important. Right now you're sitting down, you have receptors on your skin, and your butt is sending signals to your brain of the pressure on the chair. But I hope you haven't noticed it and you were focusing on what I'm saying. Right now you can feel it or something like that. And this all occurs automatically and without awareness. And the more expert you are, the more you're not aware, the more you don't have control over disregarding information. For example, there's a face here. Too much information. I can show you the face. I'll show it on the left. Here. I'll show it here. Do you see the face? Okay, so there's the face. There's too much information to process that the brain can't take on board. Very problematic for police who are looking for a suicide person in the market, and they have to let me give you another example. I'm going to put something on the screen, and I want you to say yes when you see the odd one out. It's going to be an odd one out. One of the circles is different because the black is on the bottom and the white is on the top. Let's do another one with different kind of picture. Tell me if you can see the odd one out. It's the one here. If you compare the two, the one on the left is very difficult, the one on the right is very easy. In fact, when we do it in the laboratory, we manipulate the number of circles, and on the left, the more circles we add, the more time and the more mistakes people make. The one on the right, it doesn't matter how many circles we have, it pops out. All the difference is that on the left, the transition from black to white is a threshold, all black, all white, and on the right, it's gradual. By making a simple technical change in the way I'm presenting the information has far-reaching cognitive implications to what is going on here, because the system is active and dynamic. The issue here is to engage a cognitive system on its own terms, and you need to work with it, not against it. And many times I see simulations and different kinds of training that they work against the cognitive system. They say, oh, the student needs to deal with it rather than understanding and working with it. You must really understand what is going on. And I won't go on this. I'll skip the implications to this. I'll just move this. You need to identify aircraft. It's like a disease, basically. Think of it as a disease. So there's an aircraft. It has certain features. But there are many manifestations of a disease, like there's many angles of orientation that pilots need to identify an aircraft. It can be up, down, left, right, sideways. These endless orientations that the pilot may see an aircraft because he and she are upside down and the aircrafts are moving very, very fast. And the question is, how do you train people to pick up on it? Because disease and injuries also have a lot of different manifestations. And we hear lectures here today, oh, I have a library of brains, so I have a library of examples. What examples do you use? How do you choose the examples? The same here, when you train to identify the aircraft and you want people to generalize, what orientations do you show during training? You can't show all the orientations because they're infinite. You even cannot show a lot because pilot time is very expensive. So what examples do you use to do it? Do you use these ones or these ones? What orientations are best to use during training? So they acquire it quickly, they remember it, and they use it flexibly. There are scientific answers to that. Here, it's not so important. We have a paper on that with the US Air Force. What are the optimal orientation to show during training? What does the brain like? If you don't show the ones that the brain likes, the brain will figure it out, but spend a lot of energy not learning and remembering, but translating what you gave it in a format that it doesn't like to have the mental representation that it's more effective. Many times you have a whole bunch of aircraft, like you have a whole bunch of different diseases. You need to identify the aircraft. You need to find the features of the disease. It can be quite easy if you have four aircraft that look very different from one another. If you look at this picture for a few minutes, I can test you. Distinguishing an F-14 from a MiG-19 or a MiG-21 is very easy. But what happens when you have aircraft that are very similar to one another? Like disease that are very different but have very similar symptoms. Like here, the aircraft, the two on the top are American friendly aircraft, and maybe the two on the bottom are also friendly today, depending on where we talk and the political climate, but you have Russian MiGs or whatever. But not exactly, but they're very similar in many. The nose is very similar. So what they do during training, they give it to the pilots again and again and again a lot of time. And the pilot's brain needs to learn to distinguish between the aircraft. And that's very difficult. And you do it unconsciously. The brain picks up that there's certain differences. Just like when you meet identical twins, they look the same. But after you see them again and again, suddenly you can distinguish very easily between them because your brain spends a lot of energy comparing the images, finding the differences, what is unique to each of the faces, without you being able to say why, because you know this is John and this is David, but the brain picks up that John's nostril on the right is bigger than the left, or some small, subtle feature. So we said, let's increase the training by taking the load off the pilots, and we do it. So what are the distinguishing features of each aircraft? We figure it out, we talk to pilots, or we have computer programs that compare them, and then we enhance them. We exaggerate them during training to help the pilots pick up on it. So here you find a contradiction to what we find in the exhibit hall. My simulation is realistic, high fidelity. Here I'm saying not high fidelity, not realistic. I intentionally distort reality to help the cognitive pick up on it. And we have a paper, as a lot of the research is with the US Air Force classified, but some of it is published, helping the cognitive system learn exaggerating distinctiveness and uniqueness. And we use this exaggerated, and we measure how quickly they learn to identify the aircraft. But in the field, they're not going to see distorted aircraft. The measurement is on real aircraft. So we put them in air-to-air combat simulators and see how well they learned, and we see how well they remember it. We bring them 6 months later, and how well they applied because they get scored on air-to-air combat simulators. And we have groups that study the exaggerated examples, a group that studies the normal examples, and we have it all in the paper. And it's important to teach them where to pay attention to, and you do it yourself rather than letting them do it. With police officers, when you come and meet a person, you look at their eyes, then their nose, then their face. It's very classic. Police officers, we train them when you come, what do you look? At the hand. Does the person have a gun or a knife or a fist? This is very important. So if anyone is a well-trained police officer and they look at their hand, your hand and not your face, or your eyes first, is again, what are the critical elements? And in your domain, you have to figure out what are the critical elements. I want the students to learn them so you can exaggerate them, make an unrealistic simulation, but in a way that transfers better. So this is just a few examples of the good and the bad, but I have not talked about the ugly. It's good and bad because what I've talked until now is inherent processes entailed with expertise. The cognitive architecture that is good has limitation, and we can if we understand the cognitive system, overcome them. And I've shown you a few examples. The ugly, I call it ugly because it's things that don't have to happen. Okay, to remind you where I said it's going to be ugly, the metacognition. So metacognition, what is metacognition? Knowledge about knowledge, knowledge about ability, knowledge about performance and success. So knowing what you know and knowing what you don't know. Knowing what you can do and knowing what you can't do, and knowing how well you did something in absolute terms, if you did something well or not, and relative to others also. The problem with metacognition is there's a lot of different types of knowledge about knowledge, is that people are very weak at it. People are not very good. This is normal people, not us experts. If we go and we give a questionnaire on people, how well do you drive? On a scale of 1 to 7. 7, I'm excellent. 6, good. 5, quite good. 4, average. 3, a bit less than average, and so on. You find that most people are above average, which we don't need to collect the data on driving. We cannot be that 80% of the population is above average. So people must overestimate themselves. And it's not only in driving. In the business school, they have a semester where they play with imaginary stocks, and they always overestimate how much money they made. Even if they have the data, every day they get the numbers, so it's not intuition. They overestimate how well they're doing. So generally people are not good at it, experts are not good at it. Socrates knew that when they came to Socrates and said, you're considered the smartest person on the planet. What do you know that makes you so smart? You know, philosophy, literature, physics. And he said, I know what I know and I know what I don't know, which is a very clever answer because he had good metacognitive knowledge. So when it comes to experts, over self-confidence. They're cocky, right? Many of them. So what does that mean? They mean they do not listen, always. They discourage, they frown upon, they punish disagreement. Now, punish, I don't mean they're going to tell somebody off, but they use sense of humor, right? Ha, 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 you know. They make you feel stupid. And it's not only the medical students and the nurses, all of us, we learned in elementary school, in high school, in university, that professors, teachers don't like to be challenged. Because if I'm an expert and you're challenging me, there's two options. Or you're right and I made a mistake, and then you're making me look stupid in front of my colleagues, in front of everyone. You're asking a question, oh, you know, you're right, I'm totally wrong. And I think, you know, that makes me look bad. Or I'm right and you're wrong, and kind of, how dare you, ha, 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 you know, asking that. And it doesn't matter how much you encourage people, and it's very difficult, but they discourage disagreement when you're over self-confident. Not only that, you take risks that you shouldn't take because you overestimate your abilities. You have escalation of commitment. You made a mistake. We all make mistakes. Experts make mistakes too, but we need to change it. And the more expert you are, the more you tend to escalate your commitment because you don't want to admit, I made a mistake, let's turn around and change what we're doing. You suffer from wishful thinking, confirmation bias, so you have what you said, so you're looking for the data that supports what you've said and disregard and dismiss data that doesn't support you, and it goes on and on and on. I call it ugly because the things we've seen earlier, the blue is the very making of expertise entails computational trade-off that sometimes result in paradoxical functional degradation, the good and the bad, and you have to balance and try to get only the good. But this ugly part of expertise, the over self-confidence, the cockiness, and not listening, is not inherent and is definitely not needed. In the few minutes that I have left, I want to talk about reducing and minimizing error. We talked quite a lot on the bottom of the pyramid, the perception, judgment, decision-making, risk-taking. Reducing error. Am I going too quickly? No. Okay. I'm covering a lot of information. I talked about cognitive load, not doing too many things, but the shoemaker can walk barefoot, so that's okay. So we see many times attempts to deal with minimizing error, good attempts, set behavioral expectation, educate, reinforce and build accountability, attention to detail, communicate clearly, question attitude, best practices, support each other. So thinking about training to reduce error, the classic approach has been of that sort. Try to find out the cause of errors, why patients die, why things go wrong. For example, when you talk about medication, make sure to check, are you giving the medication to the right patient? You don't want to give it to the wrong patient. If you give it to the right patient, is it the right drug? Is it the right dosage and the right time? Another example will be the red rules. Here are some red rules. I don't care what's going on. There's no exceptions. You have to follow them. You have behavioral norms like STAR, stop, think, act, and review, and a lot of them. However, this has not been very successful necessarily. For example, it's a paper from 2010 from the New England Journal of Medicine on temporal traits in rate of patient harm resulting from medical care, where they show that with all the efforts, and there's been huge efforts, some of them more successful than others, but basically errors continue to happen quite a lot, much more than they expected. It's been a decade of an effort to reduce error. So thinking about the cognitive approach, let's accept that you need to try to reduce error. Errors are not good, and we need to try to reduce it. But let's try something a bit different. Train not to avoid errors, but to recover from error. So what we want to do is train them not to avoid doing mistakes, but to detect when a mistake has happened. And not only to detect when it happened, but to train them what to do when the error occurs. So error recovery, what do? You need real scenarios and need to determine when an error occurs. You start off, and this is very, very applicable to simulation, you start gradually. First, exaggerate. Like with the aircraft, you exaggerate the error, so they're very easy to pick up. Then once they've learned that, then you make them more and more subtle, so they're harder to detect. And then you can add distractions, noise, people bothering you, another patient screaming, and make it more and more difficult. And train them to detect errors in others first, and then yourself, because it's very easy to detect errors with others. Everyone is stupid. But me, no, that's a different story. That's called attribution or misattribution theory. But there is logic to it, because when I do something, I know why I'm doing it. I know the motivations. I know the reasons. So the behavior is nested within a lot of context. In another person, I have no idea why they're doing it, what's the motivation. I see only the behavior. I focus on the behavior, and I can't surround it. So try to, first of all, do the training, see the error in others, and then in yourself. Training yourself, it's very hard to find people making mistakes, so don't be very nice and use what I call sabotage. Make them, entrapment, build it so they're going to make a mistake, and they probably will. I'll show you an example. So you have a number 13, but instead of showing it as a 13, put it in the wrong context, so they may see it as a B. So set them up, by family history or some other thing that they think, or they come into the simulation because you're going to train them on one thing, that's what they think. But really, there's going to be a different problem that they're going to screw up because they're in a state of mind that they come to be training to put an IV, but in fact, you're training them for something else, to pick up a different problem. And rather than the wrong context, you can set also, take that context out and set certain expectations, certain hopes, and stuff like that. There's a lot of ways, and I can talk about it. We have a few examples that I can talk about later. But the main issue is teach them to detect errors. So eventually they can detect when they made a mistake. And then, of course, once they've detected, you need to train them to respond to the mistake. Again, you have to do it gradually. You start off when you give them the answer. They detect an error, say, good for you. Here is what you need to do if that happens. Then you move to multiple choice. You detect the errors and you give them 5 options and say which is the right option. And the next stage, they need to generate the action that needs to be taken, and then you need to train them to take the action. So this is all nice and good, but when I say don't teach to reduce error, focus on error recovery, I don't mean to say, look, errors are going to happen. Let's not try to avoid them, let's just deal with it. What I'm saying that it's cognitively better to do this, because if you do that, they will learn for the future. And by teaching to recover from error rather than not having error occur, you're going to teach them to reduce error. It's going to make the error more salient in the mind. So they're going to avoid error by teaching them not to avoid error, but how to deal with error. The classic example I have to convey, you can tell your children or your students, when you work on a computer, save. You have to save all the time because the computer can crash, you can lose it. And it doesn't matter how many times you tell people, they do not save until they lose the file. Once they lose it, then they remember. We humans need to get burned a bit for the brain to pay attention to it. So this is kind of a similar principle, and it gives you, first of all, really to detect error and to recover from them, so you can minimize the effect of some errors, which is good by itself, but the claim is from a cognitive perspective that by doing it, you will reduce an error more effectively by training to recover than error than telling them, pay attention, don't give the wrong drug, and put a poster on every door to go on the checklist, because they don't do it for a variety of cognitive reasons. The same thing the TV ads, have safe sex, don't smoke, don't drink and drive. Do you think they help anybody changes behavior? No, they don't, and they put picture of dying people and whatever. This is not cognitively effective. I won't go into too much detail. I have like 3 more minutes, but we have a whole paper on that from 2011 with some methodology and the science behind it. And you can do it in simulations. You can even do it in videos. I'll show you an example. Here's the video. This was done by the AO Foundation. Let me try to get it in the center. It's not in the center for some reason. I have it on my webpage. I'm not sure why it's not centered. Okay, then we won't do that. Good, we don't have much time. But this is a very, again, it's on my webpage. It's very highly made by medical surgeons in a real operating room. They make mistakes, and you have to detect the mistakes and click on it. And you don't have to have a very sophisticated one. Here's an example from Ross Medical School that the students made, user-generated. Let's see if this one will work. If not, you can see it. This is how to take blood pressure.
I'm ready.
Good morning. I'm Dr. Kitchell. What's your name?
My name's Jennifer.
Jennifer, it's very nice to meet you.
Nice to meet you.
Alrighty. Well, how do you feel this morning?
I feel fine, thank you.
Great, great. Did you, by any chance, have breakfast this morning?
Yes, I did.
Okay, great, awesome. And you know, we're gonna do blood pressure on you today.
Okay.
And before we do that, I was hoping that we'd get you to stand up and just move around a little bit, get that blood flowing just right, so we get an accurate reading.
Okay.
Alrighty, great. Thank you.
Like this?
Yeah, perfect, perfect. Little.
Okay, so now the patient should be resting before you take the blood pressure, not doing exercises. And Ross Medical School has 4 videos like this on 4 different topics that the students themselves, with a video camera made. The AO, it's in a real high fidelity camera crew that costs $20,000 for the filming in a real operating room with real surgeons, but the principle is the same. Simulations, great use. I think it can potentially revolutionize education and training in healthcare. You can teach specific skills and knowledge and procedures, also higher cognitive functions of assessment, decision-making, communication, interpersonal skills. Even metacognition, bring those cocky experts and sabotage and show them what they can't do and where they need to be more careful. And there's a lot of other great things that can be done with simulations. and I'm all for it. But it can be misused. It's not always needed or benefited. You don't always need to use simulations for everything. It's not the answer to everything. It can even detract and harm certain kind of learning when the technology or innovation is the driver, when you're doing it because the medical school wants to say, we have a simulation center, all the students doing simulation, whether it's good or not, just shove them through the simulation and put it on the web that you have the latest, and I am for simulations, but it shouldn't be the driver. It's the learning that is supposed to be behind it. I have a paper about when you forget the learning and the learner and the learning, and the title of the paper, it's not what you teach, but what they learn that counts. And maybe I should write a new paper. It's not the simulation that you use, but what they've learned because you use the simulation, how to use the simulation to really remember the learning objective. And when you don't understand the underlying cognition of how they acquire the mental representation, how they're going to remember it if they're going to use it, how will it transfer best, and they can generalize and be flexible, then it may not be the best thing. And we've seen examples of problems. You know, when you didn't perceive things, when you were not flexible, when you made errors in judgment, when there was too much information on board. And not only we've seen the problem, we've seen some examples of solutions where you can reduce cognitive load, not by reducing the amount of information, by understanding the cognitive system, have pop-out effects, give the right examples in your library that are good for the brain, exaggerate and help the cognitive system figure out what it needs to learn, or use sabotage in one way or the other in simulation so they learn to detect and recover from error. You have to remember what this is all about, improving healthcare, and to do it really well, you really need to understand the cognitive mechanisms and be guided by them. So all that's left for me is to say good luck in your work, and thank you very much.